All right.
Okay, I'm ready to start.
Third person.
Okay. Go. What do Justin Timberlake, Jim Carrey, Prince Charles, and Henry Ford all have in common, besides the fact that they are all famous? The answer is that they all have been diagnosed with or to display symptoms of ADHD. What I'm going to be speaking about today is important because between 5 and 10% of the United States children have ADHD, according to the American Psychiatric Association in 2000. I myself have ADHD. I was diagnosed at a young age and know a lot about ADHD. Today I'm going to tell you about what ADHD is, the signs and symptoms of ADHD, the subtypes of ADHD, and how to treat it. ADHD defined as a neurobiological disorder. It is comprised of an inability to control behavior, to pay attention, and to resist a distraction. There are 3 types of ADHD. The first one is predominantly inattentive. The second one is predominantly hyperactive impulsive, and the third one is a combined type. Inattention includes someone that is easily distracted, has difficulty focusing on a single task, trouble organizing and completing a task, and doesn't seem to be listening when others are talking to them. Hyperactivity includes fidgeting and squirming, talking nonstop, in motion constantly, and difficulty being quiet. Impulsivity is when someone is very impatient, blurts out inappropriate comments at the wrong time, has difficulty waiting their turn, and interrupts others. Diagnosing ADHD is not easy because there's not a single test. It's a big evaluation of different things. If suspected, it must be a health professional that actually diagnoses ADHD. And signs and symptoms must persist for over 6 months before anything can be officially diagnosed. Health professionals look at other health issues and significant life changes that may be showing symptoms of ADHD that actually aren't, such as a divorce or maybe a blurred vision or something else that's wrong that shows symptoms of ADHD but actually isn't. Also, the signs of ADHD must be persistent in more than one setting. For example, it has to be in the school setting and at home. It can't just be just at school or just at home or just at work. And then lastly, there's certain tests that can be done that says if you have ADHD or not. But it has to be a full evaluation in order to officially diagnose. Since there is no cure for ADHD, the goal is to reduce symptoms and improve functioning. There's 2 options. The first is medication. It's the most common, and the most common type of medication is a stimulant. A stimulant seems like it'd be weird to give to someone that has ADHD because that is normally what wakes people up and gets them stimulated. However, with the ADHD brain, a stimulant actually has a calming effect on them. Medication can be in the form of a patch or in a pill form. Also, there's a non-stimulating type of medication. The second type of treatment is psychotherapy, which has to deal with behavioral therapy. And that just tries to help kids and adults change their behaviors in order to cope with their disorder. So anyways, today I hope you learned about the different options of treatment, what ADHD is, and signs and symptoms of each, because chances are you know someone that has ADHD.
Very nice. That was